my practice, and people say, God, every time I go home or every time I go to the store, I feel this sense of anxiousness, or my neck hurts when I go visit my mother or my dad. Or tell us a little bit about
So
that.
that's a later stage development, because most people have no idea about triggers or what's going on.
That's
So
right.
in the practice, a healthy stage is when all of a sudden they say, yeah, I went on, we had a patient like that the other day. I went on vacation, I went on a retreat, I was doing wonderful, and then the minute I came through the door, and my husband, who incidentally is suffering with post-traumatic stress, so he is going to be highly arousable, storing a lot of anger, triggered me, and my neck pain returned. So, or I went to work and my back pain returned. Even just to see that relationship,
Got it.
or as Sarna would say, to see the relationship between your perfectionism, like that you've got to be, which is a part of obsessive compulsive.
Got it.
And just to see the relationship begins to empower you to break the cycle, because otherwise you're very fearful that something's really, really wrong with you, that maybe it can't be fixed, that the orthopedic or neurologist who told you you're going to live with this the rest of your life and you've got to take these medications is not correct, right? That there is another option, that you can break the cycle and you don't have to take the medications and you don't have to live with pain. And that was one of John Sarno's big thing. You had mentioned earlier that you have to be receptive to it, because if you're not willing to even look at it, it's not going to happen. So they screen you. They're like, let's see, is this person really willing to at least look at it, And we're saying, the difference between a healthy skeptic and an unhealthy skeptic is a healthy skeptic says, I don't really know about this, Jim, but I'd look into it, and I'll come over there and I'll take a look at it. Just show me, I want to experience myself. An unhealthy skeptic, which is almost pathological in our society today, is I already know, this is impossible, there isn't any other way than what I know, because I'm the doctor, I'm the professional, I have the PhD, whatever they have, or I have this life experience, and there is no other reality, right? That's almost a pathological basis, and we can almost see that actually if you're doing a scan in a person's mind. There's certain areas that they just don't go into, and their ability to shift their attention, meaning not locked onto one part. And we often see in pain is that people get locked into, the frontal cortex is locked onto the intercingulate cortex, other areas where it's just emotionally driven in this loop. And so moving one's attention away, broadening one's attention, being able to get away from being locked in, which happens a lot in somatization disorder, is that people just continually fixate on that problem. Because there's been studies that show that, in a given month, one of the studies we talk about on our seminars is that a given month, people all have some type of discomfort. There's a certain percentage that have musculoskeletal, there's a certain part that have gastrointestinal, there's a certain amount that have sort of neurological things, but you know what? Normally they come, they kind of go. You may want to say, well, what's going on? If they keep coming back, what changes? But most of them go away. But the people that somaticize seem to like overly focus on that, right? And their focusing drives up the pain.
What initiates an individual to obsessive on those kinds of things? Is it from the ACE study? Is it from early exposure to stress?
It seems like that is a byproduct of any stressful environment. How do we know that? Because you can take a perfectly healthy individual, 20, 21-year-old in perfect health, physical health, and put them in an adverse stressful experience in Afghanistan or Iraq, and they will come back and they will become obsessive, right? They will be obsessing about fear. They will go to the local gun store and buy everything they can, Many of the patients would come in, they'd have a knife on them, they'd have guns on them, they'd be stopping their car, as I mentioned before, looking for things that don't exist.
That's extreme cases.
Right. Yeah, but that's what's one of the common, it's not extreme cases, that is absolutely the normal. When you have PTSD, you are going to be obsessing about fear, you're going to obsess, you're going to have anxiety. That is not the normal, it's the everyday case. And so it gets hidden in our everyday society because we don't recognize it, right? That anytime, it's a normal byproduct of a continual stressful response, whether it's from the excess cortisol, the autonomic stimulation, you begin to become obsessive, you become hypervigilant, overthinking, over-arousal, and you can get stuck in a loop like that. And so, but it's not often recognized, because people don't recognize things unless they're often full-blown. So, oh, that's PTSD, that's so clear. To us, we use PTSD because it's a perfect example of what happens in healthy individuals if a lot of stress happens, because they get neck pain, back pain, severe depression. Number one cause of death in the military is by their own hand. I mean, you survive 3 years or 4 years and you take your own hand. It's pretty tragic. But look at the ACE study. I mean, it seems that's the greatest correlation we've ever seen in human history, that over some thousand, some odd, 1,200% increase in suicide because of something that happened in the past, right? And that you haven't been able to release it, and it keeps stirring. And like what they're talking about depression now, you know, the whole thing was, well, maybe depression is chemical, and that's kind of fallen through because of all the new studies that have come back, that, you know, the placebo seems to work just as well, and that maybe the benefits from antidepressants are self-generated. That's a huge thing. Number two, there's no genetic relationship with depression. We thought we had one, that's completely fell apart. There's never been a gene identified. And the third one is now that we're starting to see, that early, maybe stressful experience is an abnormal response to a normal stressful reaction. And that people need to develop proactive abilities to deal with it. So unified therapy is teaching you lifetime skills. So you say, what is the goal? Give you lifetime skills, you know. And you want to go in and get sessions. You get to a point you go and get a session, not because you have to, but because you want to. Not because you have to, but because you feel so good and you want to see what you discover. And it feels great to be that much in tune. And we always need each other. We're human beings. We're very social animals, and we need quiet time. We need touch. We need sensitive people to integrate and help us along. We need to be conscious, very mindful of the process. You know, because most of healthcare medicine required no conscious interaction. And so the big thing is now we need to be conscious, we need to be mindful so that we ourselves can learn these abilities. And like I said before, what happens is it seems to become part of procedural. Healing becomes part of procedural, just the way trauma becomes part of procedural or implicit memory and deeply unconscious. Healing becomes that way, and it just happens spontaneously. And it could happen at any given moment, but you're not afraid of it anymore, and you allow it to happen. And there's a life transformed, because other people will just be having a ho-hum experience, and you may be sitting in that concert, and the music you feel so intensely, so deeply, so emotionally that you have, for all intensive purpose, a very healing spiritual experience. There's tears coming from your body's vibrating, you're feeling all these amazing things, and when you leave there, you feel recharged. You never ever felt that before, or could never felt that before if you were numb. You go to nature, you stand in nature, you go to Yosemite, you stand at the mountains, you go into the waterfall. Other people are like, well, this is nice, too many bugs here, let me leave. Somebody else, when they're present and in that moment, could get a totally transformed experience. And so in the rooms, whether it's in the chair or in the table, when we're working with somebody, they allow themselves to go ever further into knowing themselves. And they don't put limitations on themselves. And it's not, pain is just one of the least things. That's actually the least at the bottom, you know, or a particular condition.